Good morning, Board of Supervisors. I'm Dr. Dean Kelaita, and I'm the local health officer for Calaveras County with a COVID-19 update for the board and the community. In California, there's been 1,733 positive cases in total of COVID-19 infection with 27 deaths. So far in Calaveras County, we have 2 positive cases reported in the Copperopolis residence that we've known about, and we expect more cases as time goes on. Beginning March 10th, Public Health conducted a detailed and sweeping case investigation around all of the contacts to these cases, including one of the cases being a student at the Copperopolis Elementary School. Over 60 people were interviewed by public health disease investigators, including students, parents, teachers, school staff, and other community contacts, looking for those with possible signs and symptoms of coronavirus infection. From these interviews, 13 contacts were identified as being symptomatic and tested for coronavirus. All 13 were negative. Strict isolation and quarantine orders for all of the confirmed suspect cases were put into place, and no new cases of COVID-19 infection have been connected to transmission in the community surrounding those 2 cases in Copperopolis. Testing is a big question. Testing remains limited in Calaveras County due to the lack of adequate testing capacity and scarcity of specimen collection supplies. New guidelines are being distributed to the healthcare providers today to test only those patients at risk for complications from coronavirus infection with positive symptoms. Healthcare workers and those living in congregate living situations like nursing home patients, nursing home staff, jail residents, that kind of thing. Public Health is aware of approximately 60 people who've been tested for coronavirus in our community, and all of those tests, except the 2 in the Copperopolis residence, have been negative. Now, there's been some question about, why don't we know more in real time about the numbers of people who are being tested, even if those are coming back negative? The Public Health Department may not know all of that information. We know about tests that are being conducted for coronavirus infection if people are being tested through the public health laboratory system, because we have to authorize that testing in advance. The commercial laboratory system can also do coronavirus testing. An example is if a doctor tests a patient and sends that specimen to a commercial lab that's outside of the public health system, we may not know that that test was even run unless the result comes back as positive, in which case the provider and the laboratory are required to report it to us at Public Health. So there is a testing that's taking place that may be happening that we don't know about. We don't know the exact numbers. But of those that we do know...
Doctor, can't we
yes,
get that information?
Well, there are ways to collect that information, Supervisor Garamendi, but it requires us to put processes in place to be able to capture it. And we've talked about some ways to do that. For example, anytime a doctor orders a coronavirus test, to report that to the Public Health Department, and we have a mechanism to do that. The problem is getting that data in real time is not as easy as it sounds. And so we're working with the local hospital, Mark Twain Medical Center, to report to us all of the tests that they're doing through their emergency department, through their hospital medical clinics, and keeping track of that on a spreadsheet. But there is testing that's taking place in the commercial laboratory system that we don't have a good handle on. And we're trying to put processes in place to collect that information, but right now we don't. And so that's one of the limitations that we have of knowing exactly how many people are being tested, even if the results are negative. When the results are positive, we have mechanisms that are very solid to get that information right away. But for the negative tests, I can say to the community that approximately 60 residents in Calaveras County that we know about through the public health system have been tested. All have been negative except the 2 in the Copperopolis residence.
Part of the COC process there, Dean, it will help you start picking up some of those, right? The chain of custody process from the hospital?
Well, we're working with the hospital to get a process in place to get a better understanding of the testing that's being done through the commercial laboratory system. So that's, I think, the best way I can frame that.
Please proceed.
Thank you, Madam Chairman. Schools remain closed in Calaveras County upon the recommendation of Public Health in coordination with the school superintendents until April 6th. We have a consultation scheduled again with the school superintendents later today, at which time we'll discuss the time frame of the closures and whether or not that should be extended for the time being. All non-essential businesses, mass gatherings, restaurants, bars, wineries, nightclubs, all of the businesses that you see in the community have been recommended to be closed. Essential business activities are allowed to proceed, assuming that social distancing is being taken into account among those essential services and businesses. Governor Gavin Newsom on Thursday, March 19th, issued a shelter-in-place directive for all California residents. Public Health has been working with Mark Twain Medical Center on surge capacity to expand patient care from 25 beds to 50 beds. That's a doubling of the local hospital capacity. And increase ICU capacity in anticipation of increased hospital and critical care demand in the next 2 weeks. We're monitoring the current supply of medical health supplies, such as ventilators, masks, gloves, gowns, what's called personal protective equipment that healthcare workers use when assessing suspect coronavirus patients, and that are necessary to maintain the safety of the healthcare workforce. Currently, there's no effective treatment for coronavirus infection, and currently there's no vaccine to prevent coronavirus infection. Although we only have 2 confirmed cases to date in Calaveras County, we expect that there are others in our community with infection that we may not know about at this time. Testing has not been as widespread and prevalent enough to gauge the true impact of coronavirus incidents in our population. Based on this, I'm recommending the following to the public. Those who develop a respiratory illness with fever should stay home if medical care is not needed. 80% of those with coronavirus infection will develop mild symptoms of illness that resolve on their own without needing medical attention. Presenting for testing or for evaluation to the medical system takes time and capacity away from the care system and personal protective equipment from the healthcare providers that need to be used to assess patients that may not need medical care are not available for others who may need them more. If a person does develop a febrile respiratory illness, we recommend isolating oneself from others, including the public and other family members, until the symptoms resolve. Routine over-the-counter medications for cold and flu remedies can help those with symptoms of illness, including cough and fever. There's been questions about the use of ibuprofen in coronavirus infection. There was some discussion initially that ibuprofen may be harmful if people have coronavirus infection. There's no evidence of that. And the recommendation is that ibuprofen can be used in coronavirus infection for those with fever, along with acetaminophen, which is Tylenol, or other fever remedies. Staying at home, especially those who are at high risk. People at high risk for complications of coronavirus are those over the age of 65 and those with chronic medical conditions. My biggest message to the public is not to be afraid. Right now, life's been altered. Kids aren't in school. Your favorite restaurants are closed. But if we hunker down and protect those at high risk, this will pass. We have a resilient community. I've been here since 9/11. I've been here since the events of H1N1 influenza. I've been here for the Butte fire, and I've seen this community respond miraculously to those impacts. We have a resilient community, and I expect people to continue to cooperate with the recommendations to stay home, and we'll get through this together as a community. And I'm actually encouraged by my interactions with the medical care system, by the doctors, the nurses, the healthcare professionals, the local hospital. Lots of people who are considered high risk across America don't live in a community that has an acute care hospital or intensive care unit beds, and we do here in Calaveras County. And we're working with the hospital to expand their capacity to take care of patients in the event that we start to see a surge of ill people over the next few weeks. And I'm hopeful and I'm optimistic that we're going to be able to meet this challenge and get through this together as a community.
Okay, I know I heard what council said, but considering a lot of us are representing the public as we go forward, I am going to take the risk and ask staff, or ask my colleagues to still be respectful of, we are under a quasi-Brown Act, and could you just be careful on the questions that you might be asking?
Thank you.
Go, please.
Thank you very much. I respect what the council has told me, but I think the FPPC, considering we are broadcasting all of this to the wide world, can take the Brown Act and deal with it as they choose. Doctor, I want to thank you very much for all the work that you've been doing over the last several weeks, and I'm sure you're exhausted. I'm sure your team is exhausted, and I want to thank all the county staff that's working on this. What do you need from us as a board of supervisors to make your job more successful, specifically? How can we help?
As a government body, you have significantly helped this effort by ratifying and approving the declaration of local health emergency. That has allowed us to marshal the resources of mutual aid systems, to tap into resources for medical health supplies, to access those medical health supplies through our regional apparatus and through the Office of Emergency Services. There's the Emergency Operations Center that's been activated, and the head of the Office of Emergency Services, John Osborne, has been working very closely with us and has been fantastic in helping us get what we need so far as resources and the funds that we need to conduct these efforts, which are very labor intensive and time consuming.
Okay, and I know you mentioned referenced data several times and the lack thereof. Is there anything we can do as a board to mandate that you get all the data you possibly need?
Well, there are already laws in effect that require medical providers to report disease statistics to us that we ask for. And at this point, it's just the logistics of us coming up with the systems that we need to be able to track this data a little bit better and report that out to the community in real time. I'm not a real big advocate for just reporting raw data on a daily basis as we might get it, because my philosophy is, in health education, we know it's important to take medical health information that at times can be complex and frame that into a message to the public. And the message is that, what does this information mean, and what can people do with that information to protect their health? So what I'd like to do is to periodically issue data to the public in terms of a message and a context around which to understand that data, so that people get accurate information as timely as we can do it and as transparently as we can do it, and yet allow people to use that information to protect themselves from this illness and those at high risk. That's one of my most important messages.
Thank you very much, Doctor, and keep it.
Thank you, Supervisor.
Mr. Stopper, did you have any questions or comment? Not? Go ahead.
Just when I brought up the chain of custodies earlier, my experience working with chain of custodies is there's a notification center or a section on every chain of custody, and if you had the hospital add public health to that notification part, you would get the information at the same time. I'm not sure if the hospital's COC looks like the ones I'm used to using, but that would be suggested to be added. That's all.
Point well taken, Supervisor Stopper.
Do you have any?
And thank you for remaining vigilant for our community. I think this is a good time for us all to stand together and, support our community in the best way we can. And we appreciate the time that you put in for us, Dr. Kelaita.
Thank you.
Mr. Topanelli? No. Do you have anything? Mr. Mills?
Thank you. I found it rather interesting that the governor spoke yesterday to the number of people that went to the coast but he did not speak to the number of people who went to Big Trees Village or came up into our area. You saw the sign outside of Murphy's that says, if you're not local, stay home. How do we get that message across to people who want to become tourists in our area and, in essence, move a risk into our area unknowingly?
Well, that's hard to answer. I'm not an expert in tourism or in the movement of people who have second homes, possibly, in Calaveras County. From what I've been told, there has been an influx of people who typically live outside of the community into Calaveras County because they may have second homes in certain areas of the community, Arnold, Copperopolis, Lake Tulloch, those kinds of areas. So normally the population of Calaveras County may be 46,500, you know better than I do, but that population may have, for the time being, swelled to some degree. I don't have any way of measuring that, so I can't give you any more detailed information on that. Again, I would like to go back to the concept of fear. And so I want to reassure the community that we are working on this around the clock, and I would like people to, instead of fear, to channel that into concern and vigilance, to institute personal protective and stay-at-home recommendations, but not to start to point fingers at other members of our community, not to start to stigmatize others if they happen to have come to their second home outside of our community, because we're in this together.
Thank you. Dr. Kelaita, I want to thank you for doing your other update last night, I'm not sure. And I think it's important you are the face of this for Calaveras, and doing it on a more frequent basis, I think really helps the community and helps all of us, so we appreciate that.
We can point the community towards the Calaveras County Public Health Facebook page, where I posted that video, where that video was posted by the public health staff last night, which it gives a little bit more detailed information, and we'll continue to do those things using social media, using press releases, using provider alerts to the medical community, using all of the tools of communication that we have at our disposal to continue to get information out there and update the community the best we can.
Totally agree. I think all of us do. That's fine. Thank you very much.
Thank you. Thank you for your
We'll see you next
support.
week, and we'll see you on video.
Thank you.
Thank you, Doctor.
Is there anybody else out there